therapy, and I'm going to tell you that on this exam, routinely, the students take the two and they confuse them. And that's a horrible way to miss 2 points. Okay? So please don't get these confused. Empirical therapy is the use of a drug prior to gathering all of the data. The patient is indeed ill. So we're going to treat the patient, but I don't have all of the data. Can you guys give me an example of that? Tylenol? Sure. Headache? Sure, take some Tylenol. I don't know what's causing your headache. I'll get some more examples though. Some more examples of giving you a drug before I know all of the data.
However, UTI symptoms.
For what?
UTI symptoms?
Yes! So when, you know that females are more susceptible to UTIs than males because of the length of the urethra, right? So when females come in and they say, I have a UTI, and if you dare say, how do you know you have a UTI? They're going to grab you by the throat, and they're going to say, give me some goddamn antibiotics or I'm going to kill you. Because if they've had them before, they know the signs and symptoms. So when it comes to a UTI, how do you think it would go over if I were to say, actually, I'm going to have you give me a sample, and then I'm going to do a culture, and then 3 days later, I'm going to find out what the organism is, and then I'm going to call in your antibiotics.
That's not going to go well.
Bam! 2 sounds, them hitting me and me hitting the floor. Right? So the idea here is I'm going to go ahead and treat you empirically. I'm not treating you prophylactically because you already got a UTI. Right? So I'm going to go ahead and give you antibacterials, but you know what I do? I withhold them. I say, you don't get antibiotics until you do what for me?
No.
Go in that restroom and you're going to fill up a cup and give me some urine, right? I'm not saying that when you swallow a pill right now, it's going to affect your urine 5 seconds later. But I don't want you to forget and then bring me that urine sample the next day because it's worthless because now the organisms are dead. I always want to get a culture. So I'm going to say, give me that, and then of course you'll come out of the